Now, from today, Ireland's newborn heel prick test is expanding to include screening for 2 additional rare but serious conditions: spinal muscular atrophy and severe combined immunodeficiency. Health experts say early detection can be life-changing for affected babies and their families. To explain what this means in practice, I'm joined now by the GP, Dr. Máire of Ennis Medical. Máire, good morning to you.
Good morning, how are you?
Very well, thanks very much for being with us. So, for listeners who may not know, what exactly is the newborn heel prick test? When is it carried out?
Okay, it's a really interesting thing, and it's probably one of the greatest medical advances for babies. It's been around since the 60s, and it was originally for one particular illness called PKU. That's the short name for phenylketonuria, and basically, they were picking up really rare genetic or metabolic conditions. And what that means is that these were babies that were born with mostly an inability to break down certain proteins. So with PKU in particular, you couldn't actually, if you had a normal full nutritional diet, the certain proteins within that diet would actually not be broken down. They'd build up, the toxins would build up in the brain in particular, and the babies would suffer like massive cognitive decline, cause mental retardation, for want of a better description. They wouldn't thrive, they couldn't, lethargy, and they would die basically. There was many different conditions. Just that one. There's one really interesting name called maple syrup urine disease, galactosemia. And they're all based. Most of them were based around these proteins that those babies didn't have the enzymes to break down the proteins. That's kind of a simple way to put it. But what would happen is, if you figured it out, if you knew, they could be put on a diet straight away that would actually avoid any of the repercussions of it. So their outcomes were far better. But you had to know, and the heel prick couldn't be done in the first day because they had to have some exposure to the diet or to food, to nutrition for 2 or 3 days before any of these signs would come up. So that's why they're usually done within 72 hours, but not the minute they're born. So to allow the condition to kind of show itself. So it was a groundbreaking thing. And now it's not just those conditions, the metabolic ones. Now they also check for cystic fibrosis. That was a big breakthrough that kind of was put onto the heel prick a few years ago, maybe I don't know, 15 years ago, I'm not sure.
Okay, and they've added these 2 new ones, so as I mentioned, spinal muscular atrophy and severe combined immunodeficiency in particular, which can be life-threatening within the first year. So I guess really important to detect these additional conditions, but how much of a difference can early diagnosis make?
It's groundbreaking. It's kind of life-changing for them if it's not picked up, either of these conditions. So the immunodeficiency one, there are gene-targeted treatments that they can use for these things now, and also the knowledge that this is there. Babies can be protected, they can be put into kind of safer environments. There's enzyme replacement treatments that can be used, gene therapies, all of those sort of things. But most often, if these weren't detected by a heel prick, it could be months before the baby was diagnosed. And at that stage, they would have had massive repercussions from their outcomes, whether they developed an illness, a simple viral illness that killed them, or in the situation like the muscular atrophy had developed like a lot of muscular growth difficulties that actually were impossible to reverse. But if it's known in advance, then they actually do very, very well. So knowing is the answer, because these things present slowly, and you don't, in a very small newborn baby, you don't notice these early changes until they've actually already caused a lot of problems.
And will parents, Máire, notice any changes in how the heel prick tests are carried out compared to previous years when these conditions weren't screened at birth, or is it same process, just maybe slight additions?
Same process, exact same process, yeah. And I think it's something like 130 babies a year picked up with one of these conditions. So it's life-changing. Okay,
and what should parents expect when their baby has the heel prick test? Does anything change for them? Is the child a bit discombobulated in the aftermath? And if a screening result comes back positive, what happens from there?
Well, they're contacted straight away, and they're obviously put into kind of like they're brought into expert services, usually probably in Temple Street, tertiary services. And you're always hoping that there won't be a positive test here, but if there is, at least they know, and then treatments are put in place straight away, and big support groups as well around that. But from the point of view of the heel prick, it's kind of not nice. It's your little newborn, and they're literally squeezing the heel a little bit, and it's a tiny drop of blood, and that's all it is. The babies always cry for it, but it's seconds, and that's it. And it's the lovely public health nurse who comes and does it usually, and it's nice to have somebody come in and say, yeah, look, you're doing well, are you doing well, and checking up on you, and it's a positive thing in the vast majority of cases.
Yeah, got to accentuate the positives on it. And look, this expansion it took over 2 years to implement. I guess that's a reflection of how complex screening programs are to roll out. But even with the addition of a spinal muscular atrophy and severe combined immunodeficiency, I guess this isn't the end of it. Can we expect to see more conditions added to the screening programme in future?
I'd imagine so, yeah. Especially, now that a lot of genetic conditions, which would have been previously a diagnosis, what difference would it make? You've got a diagnosis, but, can their outcomes improve? But now that there's gene therapies that we can use, or stem cell therapies, yeah, I'm sure there will be more conditions put into it. But with all screening programmes, it has to be kind of economically viable as well. And that's why there's always a bit of a delay with it. But the advocacy groups for these particular conditions, I'm sure, are thrilled that this has been brought in today.
Okay, so good news, even if it does produce a few tears from your child.
Yes.
If that's what it takes to find out that they're okay, or that there is something underlying there that needs to be explored further, then it's all for a very good reason. Máire, thank you very much for taking time out from your busy day.
You're welcome.
Really appreciate that. That is Dr. Máire Finn, the GP with Ennis Medical, with us on Morning Focus.